Welcome, 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 everybody. Thank you all for joining this Saturday morning for this wonderful exclusive presentation. Without wasting much of our time, I'm gonna get started with sharing my slide. Okay, I'm gonna share my screen. All right, so what we are gathered here today is to talk more about the role of physicians and healthcare providers in our protection portfolio. Why do we think this is important? You know, before now, many of us had no idea what a protection portfolio is. And we are beginning to get to that knowledge. And as we are learning more about it, we are finding out there are so much impact that what the physicians and healthcare providers do impact the outcome of anyone's protection portfolio. Unlike other portfolios we have in this country, the protection portfolio is the only one your health matters. And who are in the front line of that healthcare decision and the diagnosis? Those are the physicians and the healthcare providers. And it's important for us to understand what impact we make. We can make or undo. We have a very important role in what happens to a client or a patient's protection portfolio. So we are just beginning to learn that, and we hope that this is an opportunity for us to learn and be more in tune as to what our roles are. So the objective is understand what a protection portfolio is, explain why life insurance is a key component, identify the role physicians and healthcare providers play, and learn more how medical insight improves financial protection planning. What is a protection portfolio? They are life insurance and some people have long-term care insurance separate. Critical illness can be added to your life insurance and terminal illness benefit. So a protection portfolio is a collection of financial tools designed to protect individuals and families from financial risk. Examples include the things that I've mentioned in the previous slide and why life insurance matters. It provides income replacement, debt protection, children's education, estate protection, and business continuity. Why healthcare providers are important in this protection portfolio? Their expertise helps to identify health risk early. It provides accurate medical documentation, and through that, they also improve patients' longevity through preventative care. So, what does that mean? If you don't know what you have, you will not know how to prevent it or how to reverse the condition. So when a patient comes to a healthcare provider, first the patient has to be identified by either going to the healthcare provider on their own, or sometimes it's because they are applying for life insurance and something is found in that process. So, but if you identify that risk early, then you will now put in place things to reverse those conditions. So, for instance, if a patient comes to a healthcare provider and during the screening process And by the way, a lot of people don't know that most insurance will provide preventative care at no cost to the patient, free, once a year. But many of us come in contact with people who have healthcare insurance, but they don't use it. Or sometimes they decline it from their job. Most jobs will offer it to you at a very low cost. Many people don't take it. But that is very important that you take that healthcare insurance. Why? Because once a year, your insurance will pay for the whole cost. Nothing comes out of your pocket for you to get your preventative care. Why? Your employer wants you to be alive in good condition so you can come and work. They don't want you to be calling in and out, going to the hospital, being admitted, put in the ICU. They are losing productivity. So they want to make sure that you are healthy. And it also, some people even get incentive once a year because they did their preventative care, such as their annual wellness, and they also have to do their mammogram if they're of age, which is 40 and older. You need it every year. Also, colonoscopy, 45 and older. All of us who have colon, you need to get your colon cancer screening. Once, you do it when you turn 45, based on the result, then they will tell you your frequency. Cancer, cervical cancer screening, that is done starting from age 21. It doesn't matter if you've had sex or if you're sexually active or not. At age 21, you're supposed to get your cervical cancer screening. So when you do those screening, for me, because of the prevalence of diabetes, young and old, little kids now have diabetes. Why? Because of the lifestyle, the foods, the drinks, the processed food. Many people drink so much soda and juice. People think it's actually a status symbol to give your kids juice. Well, what do? You are really making them at risk to get diabetes. So those things, for me, I add hemoglobin A1C when I screen people. So when you identify that risk, for instance, you identify it early, you tell the person you need to make changes to your diet and lifestyle, exercise, eat less carbs, eat less processed food, eat more green leafy veggies, stay away from sweets, and stay away from carbs. Because a lot of people think I don't eat sugar, so I'm good. But those things turn your rice, your corn, your pasta, your meat pie, they turn into sugar. And that's how many people have diabetes. So when you don't know that you have hemoglobin or A1C that puts you in pre-diabetic range, you'll be going around eating what you want, doing what you want. When you now hopefully get to somebody who tells you about protection portfolio and you want to take action and they put in application, insurance company and diagnose you with diabetes, guess what happens? Most people will be declined. Why? Because it tells them you're not even taking care of yourself. You didn't even know that you have this high risk disease, which is diabetes. But if you knew you had it and you answered yes to that question, they are more likely going to approve you, maybe at a higher risk class, but at least you knew you have it and you're taking measures to reverse the condition. But if you didn't know, you don't know. So when you identify that health risk early, you tell the patient what to do, and the patient starts working on it. That A1C will come down. If it's high blood pressure, they will make changes. They will cut down on their salt. They cut down on their caffeine. They're going to exercise, trying to eat healthy to reverse that condition, because many people don't know they have high blood pressure. That's why they call it, what is it called? It silent killer. So most people don't know they have it until they end up in emergency room. You don't know how many patients have come to me because they went to the ER for nosebleed and they find out they have uncontrolled high blood pressure. Why? Because they never checked. They thought maybe they are good weight. Remember, your weight doesn't really, in high blood pressure, if you have family history, also you are high risk of getting one. So anyway, if you identify those risk factors early, you now improve, provide guidance for the patient to change those things and improve their longevity. And the preventative measures will help you. It will actually help them get covered and also get better risk class. So you provide the accurate medical documentation, and this is very important because a lot of times many people have in health insurance, but you cannot put in any patient cannot come see you and they are just well. Well, there's no diagnosis for well. You know, in the ER, we have where we said worried but well. But in the primary care, there is no such diagnosis. You have to have a diagnosis. So you cannot make up a diagnosis for a patient because when you document something, it goes somewhere where the medical information bureau, it's called medical information bureau. When a patient puts in their application, the insurance company, their system will automatically pinpoint all the diagnoses they've had, including medications that they are taking. So those things will alert them to maybe this patient has this, maybe this patient has it. Even the medication we take for malaria prevention, in my case, I know that the insurance asks, why am I taking that medicine, or why did I take that medicine? So it's important for you to also document on the chart why the patient is taking it, because some medications are used for one thing, but it also has other off-label diagnoses or other indications that are not as bad. So it's important when you give it to a patient, you document the patient is taking this for this reason. So that is where the healthcare providers come into play. It's important that we don't just put anything out there, because when they come back 5 years later, patient is saying, I don't have this, and then you have it on their chart. It has already caused them to be denied the insurance, that the application has been declined. Now it takes longer to find out why that was on the chart to disprove it. So in the first place, we need to know that what we write there is very powerful. So what are the roles? It's providing those accurate medical diagnoses, completing, and so when you diagnose them, you manage those conditions, you provide preventative care that will lower their mortality risk. Also, completing the attending physician statements, because sometimes the insurance company require that you actually write something on that chart to support or dispute whatever they wanted to clarify. So you come into play when that happens. And it's important for us to answer those questions in a timely manner, because they may put their application in an incomplete status. And that also is impactful because you don't know what's going to happen tomorrow to that patient of yours. And you don't want to be the one responsible for them not having coverage prior to that event. So, how medical information influences underwriting? So, when you put in the application for a patient or a client, you're going to submit it, and then the underwriting process takes place. What are they going to do? They're going to find out the things that the patient or the client, whatever conditions they have. So important factors will include their blood pressure, their cholesterol level, diabetes, smoking history, BMI, and lifestyle status. So we are talking about mostly adult in this case. And this is why it's important that people protect their children, their grandchildren, protect anybody they know they have insurable interest at a younger age. Because most of the time they don't do this medical information thing, go into detail, do medical exam on children, on juvenile. They don't do that, except if they find some other diagnosis that flags them, like ADHD, autism, all kinds. Maybe they went to the hospital for chest pain. All those things will show up on their medical record. So you want to protect your loved ones before they get any diagnosis or having to go to the ER for anything. When does that happen? When you have your baby, when they are only 15 days old, they qualify to get protected. Why wait? till they will have some visit. They haven't even seen their pediatrician for the first visit when they are 2 weeks old. This is when you are entitled, when you are able to protect that child before anything else enters into their diagnosis. Children do have other conditions. Children do have cancer. They have things that they are born with that sometimes they don't even know. Remember, they do that congenital screening while you are still in the hospital. So before that results and everything that comes out, you can protect your loved one, and then they are protected for life if you protect them with the right policy, because you don't want anything that you protect them with that's going to expire before they even expire. So you want something that will last for them a whole life. The opportunities we have as healthcare professionals is encouraging them for financial protection planning. I know we're going to say we don't have time to talk about this. We need to focus on their medical problems. Remember, what happens financially impacts your patients medically. For instance, I do have patients, with some things going on in the economy, people lose their job. When they lose their job, guess what? They've lost their health insurance. They've also lost their income. So they may not be able to see you as a healthcare provider. And I've had people not be able to see me for 2, 3 years because they don't have job and they don't have insurance and they have medical conditions that they have neglected. So when they come back, either their A1C is off the roof, blood pressure is off the roof, other things is just deteriorating. And so if they can see you, that means because of their finances, that means they are not taking care of their health. And you yourself also, if you care about them, you know that you are going to be feeling bad when they come back and tell you this is what's happening. Sometimes they are going through depression, and that depression, maybe you're giving them medication for depression, but what they really need is financial protection. And you may not give them money, but why can we not offer them something that will protect their income so that they don't have to suffer that financial misery? So educating your parent patients about their risk factors and also supporting a healthier lifestyle and collaborating with financial professionals, which I talked about. Now, how would you collaborate with the financial professional? Maybe you're not licensed, maybe you're not licensed, but then you getting licensed also will help you understand what you're telling the patients. Because for me, for instance, I used to not do obesity medicine. I started doing it because a lot of my patients will go to obesity doctors and they prescribe things that I didn't understand why they're taking that medicine because they have high blood pressure. Why are they taking this medicine that can increase their blood pressure? Why? So I went and learned obesity medicine so I can understand better and treat my patients better. And what did that do big for me? Because a lot of the medical conditions are related to obesity. So if you treat obesity, you have reversed their diabetes, their blood pressure, their cholesterol. So in our case, as far as a medical or healthcare professionals, if you don't understand what you're trying to tell them to go do, then you yourself will be confused. You may even be passing on wrong information because you have no idea what you're talking about. So it's important for us to arm ourselves with the education because we went to school to learn medicine. So we have to also go to school and learn finances. Later on, I'll tell you, I've already been talking about the need for us to understand our impact. Now, understanding your impact, you being armed with the full knowledge is very important for you to deliver that information to your patient without confusing them with your own inability to understand what you're talking about. So, how do you become a financial professional? You take the exam, become licensed in your seat, and learn those laws. You don't have to do anything else other than understanding that protection portfolio so that when you talk with authority. When I tell patients that, they say, oh, how do you know this? Because I'm licensed. I took an exam, I studied, and that's how I understood what I'm talking about. So if you don't have that license, you don't have anything to back you up to say this is your authority in talking because you yourself is also confused. Now, what are the benefits to your patients and families? When a healthcare provider support protection planning, those families will experience greater financial security. Patients will become more proactive about their health, understanding that for them to get protection portfolio, they have to be healthy. And for them to have even a better protection, they have to be healthy. And then when they understand the impact of their health in their protection portfolio, they're going to remain healthy. So you will not be spending a lot of time trying to emphasize and tell them, oh, you got to do this, you got to do that to lower your A1C, to have your blood pressure control, to not gain too much weight. They already understand that for them to be able to maintain, be able to be covered, they have to be healthy. And to be healthy, they also have to do those things proactively without you spending too much time. So that helps you to actually engage with your patient. Because some patients, I tell them to do stuff, they come back, they didn't do it, their blood pressure is higher, their cholesterol is higher. What do I say? I say, please find another doctor. Obviously, you don't listen to what I'm saying. I don't want you to be wasting your time and your money. And then your family member, you tell them you're going to see doctor, and they say, oh, they have a doctor. Meanwhile, their health is deteriorating. So I say, I don't want your family to think I'm a quack doctor. Go find somebody you're going to listen to. What happens? Most of them would now listen to what I'm saying. So if your patient already understands the impact of their good health, then they're going to actually follow your recommendation and do what you're saying. They will do it on their own. Now, long-term care, and of course, when you get one protection, it doesn't end there. It's because the more you have to be, if you understand that, then you know you have ability to actually expand more of your protection because this portfolio is unending. You can apply for more. So for you to be even qualified, for you to qualify for more, you have to maintain that health status or even make yourself even healthier. And long-term healthcare outcomes will improve when you are involved as a healthcare professional and encouraging them to have protection planning. And financial stress is reduced. How and why? That is reduced once you have that peace of mind, knowing that if anything happens to you, then if anything happens to you, you're able to, your family are not going to suffer. Yourself will not suffer because you have this protection. And that's why it's protection. It gives you peace of mind. The stress of worrying what's going to happen if I stop working today, I no longer have my income. What will happen? If you have a protection portfolio that has cash value attached to it, that is going to support your current lifestyle. So that relieves your financial stress, overall stress, life. You're just going to live life and enjoy it as it comes. You don't have to worry too much. So, what are the roles that the healthcare providers have in insurance approval process? So, we talk about the need to have those protection. Now, what is our role for that process for them to be approved? It's one thing applying. Many are called, only few are chosen because they have to check your status, your health status, and they use that to determine if you're going to be approved. What is our role? It is very important that we have accurate diagnosis on the chart. If you put in that the patient has something, they come in to see you for chest pain, you do EKG, you do everything, you find out that chest pain is benign, you're going to put that is benign. Now, if you think that they need further workup, you refer them to the cardiologist to go do their cardio for their workup. Now, if they go to the cardiologists also have to do what they're supposed to do, rule out that they have something going on, and then put on their own chart that the chest pain is benign. That is very important because if you didn't do anything, didn't tell patient to be go to the cardiologist, but you put there that the chest pain is something that you're worried about, we never told him to go, or you told them but never went, or they went and the cardiologist does their own thing and saw that is fine, but they never concluded on the chest pain being something benign. When this client applies for insurance, what happens? They're going to be declined because they have heart condition. And patient is like, I've been walking around doing my stuff. Nobody told me anything. And of course, most of the time, they may not even have been told that this chest pain diagnosis is still hanging, that it has never been concluded, that it's nothing to worry about. It's also important for us to clearly document why we're doing stuff, what we did, the outcome. So it's important because if you leave it out there, it's there on their chart, but nobody knows why that happened. Okay. And proper medical testing. If you feel that the person needs to have a echocardiogram, stress test, and all those things, you let the patient know. Let them know they're going to go see the cardiologist, and they go see the cardiologist. Now, what the cardiologist does is up to the cardiologist, but it's also important that the cardiologists conclude on their own testing and not leave it out there hanging. That patient came, they do all that thing, but they never told the patient, okay, it's fine, no worries, see you, or either you don't see me, see me. So communication of true health risk. If you find they have a health risk, you tell them what the health risk is and what to do to mitigate that. And those things are important in their insurance approval process. So key takeaway is life insurance is a cornerstone of financial protection. Healthcare providers influence this risk assessment, and preventative medicine improves insurability. Collaboration between medicine and finance benefits the patient. So I'm going to use a few case studies to illustrate some of the things I talked about. So imagine a 44-year-old small business owner needs $1.5 million insurance. Their initial health risk, BMI of 32, which we know is obesity, 30 or more is obesity, and elevated cholesterol, blood pressure is high, and their lifestyle is sedentary. They don't move much. So these are their health risks. What are the preventative measures you will take when you see this patient? You're going to encourage them to change their lifestyle, exercise, blood pressure monitoring, cholesterol management, regular follow-up visits. Patients continue to do that, and then 1 year later, their BMI has gone down to 27 from 32 to 27, which is overweight range, and blood pressure is still a little high. Cholesterol is high. Activity level is also, they have improved their activity level. So now this cholesterol numbers is high, but even though it's high, they have improved their BMI, but they have also started working on things to mitigate their risk. That shows that they are actively doing stuff, even though it's not perfect range. The underwriter is going to approve this patient. So it will reduce their premium by a certain amount. So that is the importance of what we do. It doesn't have to be perfected, but knowing that the patient has instituted all these lifestyle changes is going to help. Next is a $2 million policy that was declined until the physician stepped in. So they put in application because the routine medical exam showed EKG abnormality, and that abnormality, the underwriter flagged it potential cardiac issue. Remember, the protection portfolio, the insurance is actually taking a risk on you. They are hoping that you're going to stay healthy, you're not going to die early, you're not going to need you're not going to have critical care or long-term care. So they want to assess that you are at least healthy enough to actually live long enough so that it will be valuable for them. So before they approve you, you go through that underwriting. They found out that the person has a high cardiac issue risk. Well, you as the physician or healthcare provider, if you didn't know all this, when this happens, you're going to order this, send them to the cardiologist. That's what I'll do. And the patient will see the cardiologist. If the cardiologist do the stress test, echocardiogram, because not all EKG abnormality means heart problem. And so when they go and do all this cardiac evaluation and the cardiologist say they are good, that policy was approved. So, but if you didn't step in to refer them to get all this cardiac workup, this policy will be declined. And that patient, when they have decline policy on their history, it actually makes it even harder to get approved elsewhere. So protection portfolio is all of these. This is in summary what I just talked about. I'm going to continue with this. Why the physicians and healthcare providers are one of the most important voices in this. It's going to be accurate diagnosis and documentation form the foundation of that medical record that insurance rely on when evaluating the risk. And these medical records and underwriting, insurance company will assess the patient's eligibility and their premium based on clinical history, lab result, and physician report, and then the protection and financial security that the patient will get because they got approved. So you're not only guidance of health, you're also critical contributors to the patient's financial portfolio. We provide wholeness. Physicians and other healthcare providers will protect health. Financial professionals protect financial security. But when these two perspectives come together, we gain a powerful opportunity to protect the whole patient, both medically and financially. So this is not only, our position is not only to provide the care, but we also need to provide the wholesomeness, provide the medical and the financial protection. So we're going to defer questions to the end. We have other speakers. I'm going to call Dr. Benny to shed more light into this topic. Please, you stop sharing. It's Dr. Benny. You can unmute yourself.
Okay, thank you so much, Dr. Linda. Always a pleasure when you present, and thank you for those wonderful information that you just gave us. Hi, everyone. If it's okay, Dr. Ru, can I share my screen?
Sure.
Okay, you can see my screen?
Yes.
Okay, very good. So good morning, everyone. We're afternoon now. It's 12:06. My name is Dr. Benedicta Olobegi. I'm a nurse practitioner and also a licensed financial professional. I am glad to be here today, and thank you, Dr. Ruth, for giving me the opportunity, and thank you, Dr. Linda, for the starting up with a great step. All right. So thank you. We were talking about financial portfolio and healthcare providers and how they are, what is their influence and their impact in this arena, in this crusade of no family left behind that we're doing. So I would like to start by introducing myself. Like I said, I'm Dr. Benny, and I want to start with talking about my journey from healthcare to financial portfolio. So like I said, I'm a nurse practitioner, and most of the time, most healthcare providers, what we do is diagnose patients and treat patients. And while we focus on protecting our patients, we realize that many of our providers are not protecting their financial future. And most of us are exposed to protection. We are exposed to financial catastrophe if anything happens to us. So the discussion today is, how do we protect ourselves? How do we make that protection planning change that will help us and our family? So why is it that we're having this conversation? Why does this conversation matter? So healthcare providers, every day we save lives. We go out there and we diagnose our patients and try to get them to feel better. But many of our patients who survive illnesses, they lose their financial stability. So most people that we encounter every day are either having minor problems or they have serious problems. And most of these problems have the capacity to change their income or deplete their savings or force them to sell their assets. And then cause some financial stress on our family. So this conversation is important because healthcare workers can help to bridge that conversation between healthcare and financial protection so that our patients and family members can be connected and understand this discussion so they can help to protect themselves better. So what changed my perspective? Hold on, give me 1 second. Something is not right here. Okay. Okay, there you go. All right, so I've been in healthcare all my life, for the most part. And what changed my perspective into going into the
Dr.
financial?
B is not on a slideshow.
Okay, I'm sorry.
Okay.
Let's start from the beginning. Okay. All right. Okay, so I talked about why this conversation is important. It's important because when there's a serious problem, a lot of our patients and family members and healthcare providers tend to lose their income, deplete their savings, force sale of assets, and cause so much financial stress to our family. So for me, as a healthcare provider, what changed my perspective? Why this journey? Why did I start this journey? Like I said, I'm a nurse practitioner, and for many years, we diagnose and treat patients. But I started to notice something, that many of our patients who become sick or survive illness become financially stranded due to increase or high healthcare costs. So that experience changed my perspective. So I began to think about how is it that, we work all our lives, and as soon as there's a problem or any health issue happens, most of us tend to become financially stressed. And that's because we have not planned our future. We have not planned for these unforeseen events when they happen. So I began to learn about protection strategies. I'm like, how does this thing work? Why is it that most of our loved ones and patients get financially stranded when problem happens? So the first thing I did is that I started learning, I started asking questions. So, and then I learned about financial protection or protection planning. I researched for so many years. And then when I was sure of my research, I spoke to some financial professionals that you're looking at, that are here today. And I just realized that something is missing. And then I decided that, okay, that in order for us to stop this financial stress that our patients and our loved ones get into when there's a serious problem, we have to have financial conversation with them. How is it that you can best protect yourself before any of these things happen? So when most of these patients don't get protected, they are waiting to get more information, or they don't even have this information. This waiting can become very, very dangerous. Okay, so once I was convinced that I need to get protected, I took action immediately. I got some protection for myself and my family. And after I did that, the next thing was that how do I get licensed so I can begin to educate more families about this, how they can bridge their health care and their health issues with their financial portfolio. So since I got my license, I started helping people and started talking to my friends and my colleagues and trying to get them to get secured and get protection before something happens to them. So the healthcare providers paradox. So healthcare providers are the most important people in this crusade that we're talking about, because we understand prevention. We understand that prevention is better than cure. And nobody understands prevention better than us, because we are the first line providers. So healthcare providers, how is it that we can help in this situation? We can encourage our patients. We always do. Right now in practice, we encourage our patients to get screened early. And once they get screened early, there's a probability that we can treat them early if something is found. And then when we do that, we are able to prevent complications that could have cost them a whole lot of money in the future. So now we get them to also understand their health impact in their income. Because if we don't have that conversation about finance and how this can impact their health, most people always end up into this problem that we're trying to avoid. Now, what I'm trying to say here is that when you have no health, you have no income, you have no financial protection, that will be a big disaster. So when it comes to financial protection, many people wait, but sometimes they wait until it's almost too late. So how do we get healthcare providers involved in this crusade or in this conversation? Because what we're trying to prevent is that ourselves, our loved ones, and our friends and our patients don't become financially stranded when they get sick. So now, diagnosis versus financial diagnosis. Now, medical diagnosis help to identify risk. And when we identify risk, we have to create treatment plan to help that thing that we have identified. And in doing that, we are able to prevent complications. Now, the same thing goes with financial protection planning. When we're able to identify financial risks in our patients, where you know that this patient is potentially going to have problem because of their lifestyle or their genetic consequences, you help to get that conversation started and let them know that, you know what, you need to protect yourself before something happens to you. So the healthcare providers are in a position where we can have that conversation with our patient, not only about their health, but how they can protect their income so that when something happens to them, they are able to survive the catastrophe and be able to still continue to live life, even if they are still sick. So building protection portfolio is an important conversation for us to have in healthcare. So that's why it's important for us to educate our healthcare providers about this so that we can start having this conversation with our patients and our loved ones now before they have any problem. And in having this conversation, we're able to prevent financial catastrophe. Now, healthcare determines life insurance approval. So why is this important? Most people do not realize this, that life insurance approval depends heavily on how healthy you are. So most people, the insurance underwriters, they use so many things so many criteria for the approval of our health insurance. So, I mean, of our life insurance policy. So one of the few things that they consider is your current health. How healthy are you? If you already have a lot of illnesses, you have the chance of being declined. Another thing is your past medical history. What are your diagnoses, the medications that you're taking, and your chronic conditions? These are the things that insurance company underwriters evaluate before they can grant an approval of a policy. The healthier someone is, the easier and cheaper the protection becomes. So when you are able to identify that this patient has a better chance of getting this policy approved, we can have that conversation and encourage them to get the protection before something happens to them. Now, what happens when a patient waits too long? So many patients might say to themselves, I will get life insurance later, or I am still healthy, or I'm not worried about it yet because I'm still young. But the problem is when illness does not wait. When illness happens, there's no coming back from it. So one diagnosis can change everything for anybody, both for us, our loved ones, and our patients. So what happens when that illness comes without protection? When your loved one, yourself, or your patients don't have protection. Now, they are in the hospital and they're sick. The medical bills are high. Their income may stop depending on what kind of situation that they're in or what kind of diagnosis they have. Now, retirement accounts might be drained because they're trying to use up all the money they have to protect themselves or to take care of themselves while they are sick. Sometimes some people may have to sell their homes because they need money to take care of their loved ones. I have seen that. There was a case I saw on TV recently, or maybe on Instagram, about an 83-year-old man that still was working at Myers. He's 83 years old. He's worked all his life. He made money, a bunch of money. Unfortunately, his wife was sick. And for so many years, she was sick for almost 12 years, and they were running around trying to do everything. Medicare was not enough because of the diagnosis that his wife had. They depleted everything that they had. And this guy had to take out almost $300,000 of equity out of his home to help his wife. And his wife eventually passed away. And then he's left with all of this debt. He's 83 years old and he's still working. And he still owes more than $300,000 on his home. When do you think this man is going to pay off his insurance? It's probably not going to be able to pay off his mortgage. Probably not going to happen in his lifetime. But in order for him to still have a shelter over his roof, this guy went and started working at Myers. And he just got lucky that one day some guys came to the store and they met him and they talked to him and they publicized his case. And many people did crowdfunding for him and they were able to raise about $7.5 million for this guy. But that's one out of 200 million people. That's what we're trying to prevent, that when an illness happens, it may be too late for you to protect your loved ones, yourself, or your patient. So this conversation is very important that we start having this conversation among healthcare providers. Again, some families may face financial crisis. This is something that we see every day. So illness can destroy decades of financial progress. So this conversation is important. We need to start having that and making it a normal part of our healthcare service that we provide. You know, telling the patients that their health goes in hand with their finances, and if they plan early, they will be able to prevent all of these problems later on. So how does the good diagnosis correlate with financial protection? Now, correct diagnosis will lead to proper treatment. Early disease detection improves outcome. That's what we do in healthcare. Now, the same thing goes with financial protection. If you have early financial planning strategies, you are more likely to strengthen your protection. The earlier protection begins, the greater the security that you're going to have. So when that disease hits, you're not scrambling or running around trying to scramble to find money, or relying on your friends or family members to help you at that time. When you have a protection, or if you have a life insurance policy, your insurance will be able to pay out when you need it, and that might be able to help you to offset most of this financial burden while you are sick. So bad and delayed diagnosis. So as healthcare providers, we know already that late diagnosis can cause complication. Treatment becomes very difficult because that illness was not diagnosed on time. Same thing goes with our financial portfolio. The financial equivalent, when there's delayed protection planning, families are left exposed when life event happens. And by that time, it is too late because you don't have protection. The insurance company is not going to insure you at that time. And guess what? What happens to you? Either you lose your life savings, or you sell your assets, or your family are left there to suffer financially. So what is the impact of protection placed early? So when we have a financial protection on time, when there's a protection, when protection is secured before an illness happens, now you are able to, your income protection exists, family maintains their stability, asset remains protected, retirement remains intact, and loved ones are secured. This is what we are trying to get at. When we are able to have this conversation, when we see a patient who has a problem that's probably going to cost them their life savings, before that diagnosis goes into the chart, we can tell them, I need you to go get a life insurance policy now. Just in case, if this diagnosis that I'm going to put in your chart becomes a bigger problem, that you have something to fall back to. Because most people think that, oh, I am healthy, nothing is going to happen to us. Illness is not a matter of when. It's not a matter of if, it is a matter of when. Most of us are going to get sick or get some kind of illness at some point. Right now, we are healthy. We're walking around healthy. Nobody knows what is brewing inside of us. And one day something might happen. And when that something happens, do you have a protection account that can protect you? That's why we're having this conversation. As healthcare providers, we want to normalize this conversation with our patients. We want to make them understand that you have to put these things in place before something happens. Because most people, like I said, will say, oh, I'm healthy, I'm not ready yet. But with the time that they are ready, or when that illness happens, life insurance company are going to deny them. So protection turns a crisis into a manageable situation when that planning is, or when that protection is placed early. The role of healthcare providers, what role can we play in this situation? Healthcare providers can have incredible influence. We have the voice, we have the influence on our patients, and our patients trust us. So we can help by educating our patients that healthcare determines financial protection eligibility. Early diagnosis can improve outcome. So is financial protection works the same way as well. So early protection equals better financial outcome. Late protection limits or keeps you option vulnerable. You have no option at that time when it's too late for you to get protected. Now, our goal is that every healthcare provider here should be able to encourage their patient to protect themselves while they are still healthy. This can literally save their financial future. So saving patients' assets, how do you help in this area? Protection planning helps to prevent loss of retirement savings, loss of generational wealth, family financial hardship, and you already help patients protect their health every day. So now we can also help them protect their asset and protect their legacy. And charity begins at home, right? Before we do this, we have to make sure that we are protected ourselves and our loved ones are protected. and our friends are protected. And then we can have that conversation with our patient. But in order for you to have that conversation with your patient, you have to start with yourself and your loved ones first. So, legacy thinking. Now, healthcare providers save lives every day, but true impact goes beyond treatment. Legacy means you're helping others protect themselves. You talked about this protection portfolios, how it correlates with their health. You have that conversation, like I said, starting with yourself first, and then your family. And this can help your family and yourself and your patient to protect their assets and probably protect their future generations. Health protection and financial protection work together, and we need to start normalizing these two things as two objects that work hand in hand. So now, the call to action. The best time to protect a life is before the diagnosis happens. Early education will help your patient to prevent these problems. Now, my call to action is for every healthcare providers here to join the crusade to help protect their assets and help to secure your future and the future of your patients. Because once illness arrives, the window for protection may already be gone. So be a part of the conversation. Join this movement. Now, in conclusion, we diagnose and treat patients or illness every day, but there's another diagnosis many patients may never get to receive on time, which is financial protection. A single diagnosis can change everything. One diagnosis can help income, can stop your income. One diagnosis will stop your income or can stop your income, can also wipe off your entire life savings, can cause you to have your assets sold, and can cause generational wealth to be lost forever. So my advice here is that by the time illness comes, the opportunity for protection may have already gone. So healthcare providers have the trust, we have the voice, we have the influence to change this by educating our patients while they are still healthy. You can help your patient protect their family, their asset, and their legacy by having that conversation. But first, start by protecting yourself, okay? We already protect our patients every day. Together, we can help protect their financial future too. So thank you so much, everyone, for being here. I do appreciate everybody's time, and I yield it back to you, Dr. Ruth. Thank you.
Wow. Wow, this is so amazing. Just hang in there. We have one more speaker. But before I call the last speaker, I want to give Dr. Linda 1 more minute to say something before I call on our last speaker, Dr. Linda, Dr. Ola.
Thank you, everybody. Thank you for hanging in here and getting this important information. I just wanted to, share how this information has impacted me. Previously, I didn't have any idea of what this is all about. I got insurance while I was in residency. The one that they provided to us, the one that the person spoke to us about, was a term policy. Now, nothing wrong with term policy, but it's good for us to know the options, things that are out there. What do you do differently? When I got the term policy, I was much younger. It was my second year of residency. And at that time, there was no medical exam. I was paying whatever, 50 something dollars a month. So I got what I could afford, got my husband, got myself. Of course, nobody told me anything about my children. They didn't know better. When I finished my residency, I had to get insurance for disability insurance, which is one of the things they call a protection portfolio. As you all know, disability insurance only covers you 60%. It provides up to 60% of your income. Imagine we are living at 100% of our income. Most of us still have to try to find another way to make that work. So 60% of your income when you are unable to practice as a physician or as a healthcare provider, those are the things they want us to get, to protect us while we're still alive. Because term insurance is if I don't die and I have to have any issue, I'm not able to practice. So that disability was supposed to help. But then I was looking for disability insurance, but I couldn't even get it at that point because of the diagnosis of my child. And I'm talking about myself. Diagnosis of my child that was not discharged when I was having a headache as a resident, and my attending physician gave me a diagnosis, but I never went back for it to, well, I wasn't asked to go back to discharge it that I was no longer having headache. So when I applied for the disability insurance, when I have finished my residency trying to get disability insurance, I was declined. So I had to go to primary care to now discharge that I was no longer having headache. So this is personal story, and this is why it is important for the healthcare provider to understand the impact of what we do, how it affects the patients or the client. And I wasn't able to get covered. I had to wait, and I applied again. I was declined for another health problem. It just went on and on until Dr. Ruth, that you're seeing here, came to me. But prior to Dr. Wood, another person has talked to me about protection. And I said, don't worry, I'm not going to. So they protected. Then I said, okay, you can have something for your mom. Okay, my mom was right there. We got something for her, but what we got was what? Final expense. Mind you, they didn't tell me anything about any life insurance policy. Of course, maybe they didn't know better, because they could have told me what I could get until when my mom had a medical condition that I was going home every day at lunch to take care of her. People even thought I had a baby, I had to go breastfeed at home, but I was going to check on my mom. And I called this agent. I said, what? Wait a minute. I thought I had something that could help. And when somebody is sick, they say, oh, no, that's not what you have. What she has was final expense. So that means she has to die, and that was the final expense. So I'm talking from a perspective of somebody who was ignorant, and also to what could have happened differently. Now, when I got this information, when I sat down, when Dr. Wood talked to me, I protected my children. I didn't protect myself at that time because I was still going through this insurance thing, getting declined up and down. And I regretted if somebody had told me something, because the disability insurance that I was looking for is also found in the IUL with a cash value, because that has the long-term care, the chronic illness, and all that. So that also builds a cash value while I'm still alive. So those are some of the things that after I got this information, which she asked me, do I want to know more about the law that governs my insurance, the policy I have? I realized I knew already that I didn't know anything. I have no clue. And I'm somebody that want to learn. So I said, of course. So I learned. I got licensed and I got my protection. I understand more. Every day I'm learning more and more. And this is the power that comes with knowledge. When they say knowledge is power, it's really powerful, because that has equipped me to understand what I have, what I can do to prevent others from making the same mistake. Because the problem we have in our society is that a lot of people, especially in our physician community, we have been sold buy time, invest the rest. Many of us are not even investing the rest. When you turn 65, your term policy has expired and you're still alive. What are you going to do? And what are you going to do to maintain your lifestyle that you have currently as a healthcare provider, as a physician, and you don't have anything? And this is why we see a lot of us still working in our 80s. That is not acceptable. So we cannot continue to make the same mistake and think it's okay. They say that insanity is doing the same thing and expecting a different result. If you see that it's not working and you look around you and see all these people you're looking at and you see that whatever they've done obviously is not working, because that's why they're still in the workforce, then you don't want to be there. So find out what can you do better. And this is why we're just sharing a tip of the iceberg. So whoever invited you here, if you don't know what we're talking about, you want to know more, please ask that person. If you don't have anybody to ask, you can just, Dr. Ruth is here, the people you see on the flyer, just ask. Even the person who invited you, if they don't have any clue what they're talking about or what you're asking, ask for more. So that's what I'm going to talk about now. Thank you all for coming.
Thank you, Dr. Linda. By the way, this is our first time doing this, and we're going to do this once every month. But don't go yet. But before you go, before I call the last speaker, if you look on the chat, you will see a survey. Please complete that survey for us, please, because we want to make sure that everybody, no family left behind. I want to give this opportunity to Dr. Ola, a few minutes to add her voice to this. Dr. Ola is also a nurse practitioner, just like Dr. B. And Dr. Linda is a physician. She have her practice in Frisco. In case you're looking for a primary provider, you don't have one. Her office is in Frisco, Texas. You can always go there. Now she's a holistic provider. She's gonna make sure your finances are in place. You're not just receiving medical care, you're receiving financial care. Just to let you know. So you have a competent provider who will look at your entire portfolio and make sure you're treated the right way. So I hand over to you, Dr. Ola.
Thank you so much, Dr. Ruth, Princess. Thank you, Dr. Linda and Dr. Benny, for addressing what we need to know as healthcare providers and our responsibility to our patients. Do you mind if I share my screen, Dr. Ruth?
So go ahead.
Can you see my screen now?
Yes.
Let me do slideshow. All right. So I want to address this topic from the point of view of what do we need as providers to take care of ourselves? Because when we know how to take care of ourselves, then we can take care of the patients. We will know what to do. So my topic is the intersection of healthcare and financial literacy. How do we manage that intersection? First for ourselves as healthcare providers, and then we can put that knowledge to use for our clients, our patients. This is me. I've been in healthcare for the past 38 years. That's a long time. That's a very long time. And the surprising part of it is that I went to my education to the highest. When somebody gets a PhD, that's the highest level of education. And I thought back then in 2015 that I'm done. I have arrived, I'm done. But then here comes Dr. Ruth to tell me otherwise. And I realized 10 years after getting my PhD in March of 2025 that I have not learned nothing when it comes to financial literacy. It joggled me because remember, I thought I'm at the pinnacle of education. But when I got to learn about financial literacy last year, I diagnosed myself. I have a license to diagnose people. So I gave myself a diagnosis that I have a disease that is called financial ignorance. Big time. For all of my 38 years, I knew nothing about financial literacy. Something that also shook my intelligence is this financial literacy is actually what I need to fulfill me, to be able to make better all the other education I've had. This is the foundation that I need, so it is worthwhile. So I have the disease. I hope who are the people that classify diseases can put this among them. It's a big one. It needs to be cured. So how do we cure it? As licensed financial professionals, we cure that disease by doing these 4 things. We identify people like me who have no financial literacy. We educate them. We teach them how to protect themselves. And then we empower them to go protect others. How did this work out in my own case? This is Dr. Ruth here, inviting me to a Zoom discussion. So many Zoom discussions we've all attended. At this time, it didn't make any sense to me at all, whatever she was talking about. I was just too tired and busy. But she did something. I think they acknowledged her for something that she posted. And I asked the question, how were you able to achieve this at this young age? And then she said something that is now very familiar to me. Thank you, ma. She's always respectful. Thank you, ma. Are you available today or tomorrow to show you what I did? To show me what she did. I don't even remember what I said in that thing. It's not caught in this thing. But anybody who knows Dr. Ruth knows this language. Are you available today? She doesn't waste time. She's ready to protect and to educate. Are you available today or tomorrow to show you what I did? I guess finally I responded to her one way or the other because I got educated. How did I get educated? I actually had to take an exam. I studied. And the same body, the state of North Carolina, that licensed me to work as a nurse practitioner, people, is the same state that has now licensed me as a financial professional. In fact, North Carolina is so strict about this, the education. They required me to take 3 separate exams before they will license me. Wow. This is a real business. I got licensed just like I did for my nursing. And guess what? Those of us who are medical providers knows the importance of obtaining CEUs to maintain our license. The nurses, we call them CEUs. The doctors, we call them CMEs. I don't know what the dentists call their own, or social workers. But guess what? Every state in the entire of the United States and Canada requires a licensed financial professional to have CEUs 24 hours every 2 years. So this is a really well-regulated industry that I never knew of until recently. And something else that I got to know is the reason I didn't know about it, it's not my fault at all. It's not taught in schools, not at all. Some of us who are CPA trained, who are accountants trained, tell us this education is new to them too. They didn't train them in school. They train them something else when they do accounting, not insurance. So you need to do continuous self-education. Every one of us here knows we need to have like a 5-year orientation. The good thing is while you're doing the 5-year orientation, you're getting paid. So that's good. Dr. Ruth has been here now for over 5 years. She's still in elementary school. So I'm still in kindergarten, daycare, drinking milk. But continuous education helps us. Look at all those books we have to read. And each day I get enlightened. I'm like, wow, where have I been? This is part of our education. Every opportunity that we get educated. If you want to learn about financial education, you hear about Emmanuel Chita, you know he knows what he's talking about. So here he is sharing his knowledge with us. You want to learn about financial education? Here's a guru. His name is Daniel Fumbo. I'm very delighted to be tutored under him. You want to hear about financial education? Here's Dr. Ruth Ifediora. She can do this in her sleep. So we have a good system here to train us health professionals to add to our knowledge, to become financially literate. And so I got the education and I went to town. They set me loose. I went to town. This is my very first group presentation to my community. You know, when you know of something good, you don't keep it to yourself. You want to share it. You want them to become empowered too, to become educated. So this is my very first one. You can see that little girl there. Who knows what she will become tomorrow? She was listening to it too. More education. There's no end to education. Here's more education. Okay, so now I'm educated. Now I've learned to protect myself. What did I do? I did what they teach us to do in the airplane. When you sit down in the airplane, they say, when something happens, when there's an emergency, put your own oxygen mask on first. Then when you start to breathe, then you can help somebody else around you. So I got protected. There's a whole story to this protection I'll tell you later. But I got protected. I got my oxygen mask on. I also learned that there are other ways I could protect myself. I've been paying 2% of my money that's in the 401k and my IRAs to this manager that I never hired. I learned to fire that manager because I moved my own 401k and my own IRA into annuities. So that means I have 2% more of money in my pocket. And in addition, I was given 22% instant bonus for moving that money. And on top of that, I was paid for doing this all on my own behalf. Who pays you this kind of money in healthcare? Even though we work so hard. So this is what financial education literacy does to healthcare providers. We become liberated. We know more. We do more. We're better people. So now, when it comes to empowering, for you to now empower the community, how does that work? I have learned that financial empowerment leads to financial protection. You've heard my colleagues talk about these two today. But let's go to those who really know. Some of us here are from Nigeria. We are familiar with Central Bank of Nigeria. And in the Central Bank of Nigeria, there's a governor. Well, let's talk about Central Bank of America. In America, it is called the Federal Reserve System. And during the time of Obama and before Obama, this guy was there as a chairman, Ben Bernanke. If you read that thing in the red square, it tells you that Ben Bernanke trusts insurance products more than he trusts their own banks in America. He has most of his finances invested in insurance products. Hello, say that again. This is somebody who actually studied finance. Unlike me, who studied medical, he knows this thing in and out. So he knows if he puts his products, his money in insurance products, it is safe than if he puts it in the bank. Wow. Okay. Now, this book was written when? 2013? We might say, well, that was then. Oh, no, look at now. This is current. This is the current chair for the Securities and Exchange Commission in America. He came into power last year. Him and his wife, they have 54 life insurance policies. Why, you may ask? It's because he knows, his family knows the benefit of protecting themselves, the benefit of leaving a legacy to their families. Things they don't teach you in school. Things they don't teach you in school. They know. So now it's time for ourselves to teach ourselves how these things benefiting other people, how can we benefit from them? This is one of the ways people who knows about insurance policies benefit. This is a coach, NFL coach, who with his intelligence drafted his contract with the Michigan State University to include a $14 million life insurance deal. Wow. How did he get to do this? So Michigan State will give him $2 million each time for 7 years as a loan. And then he uses that loan to pay for his life insurance. So when he's alive, he's enjoying this money. And then when he dies, Michigan State gets back their $14 million from the life insurance. And then the family gets the rest. Win-win situation. Healthcare providers don't have this type of knowledge. We're busy, so busy taking care of other lives, we don't know how to take care of ourselves. We need to have this knowledge. How can we have this kind of, what is it called? Not policy, when we get an employment, and they draft us our agreement. How can we do things like this to make our lives better? We need to start getting smarter by looking at what is happening around us. Because if we don't, lack of financial literacy leads to poverty in our community. And then we start to beg in the form of GoFundMe and committee of friends. And then before we know it, we're bankrupt due to no fault of ours, just because we got sick. Financial literacy is powerful. Look at this guy, Bob Lee. He was a millionaire before he died, but he wasn't financially literate. So that taught me something else. Financial literacy doesn't have to do with how much money you have, because you could have little and be financially literate, or you can have much and not be financially literate. He was a millionaire. He wasn't financially literate. When he died, his brother had to be begging for money through GoFundMe. Look at for this millionaire, they only raised $14,528. 73 people only donated. Can you imagine? A millionaire. We don't want this to happen to us. So my people, if you think education is expensive, you wait until you see how much ignorance costs. How can we eradicate this ignorance in our community of healthcare providers, or even just reduce it to start out, to reduce it? We have to come to this intersection of financial education and healthcare. What are our responsibilities? What do we need to do? What do we need to know? This is a doctor who wrote this book. He wrote there, if you look in that red box, 401k is for people who are planning to be poor when they retire. Say what? According to Robert Kiyosaki, this is what we are giving as a benefit. This is what we're giving to attract us to get our doctor job, our nurse job, social work job, pharmacy job. Oh, we have benefits for you, comfort, 401k. And now we're learning, and we all know it's not all what it's cooked up to be. So since we don't want to be poor when we retire, what things do we need to do? We need to learn how money works. We need to understand money for ourselves. We need to know, do we want our money to work from fixed income, variable income, or index? Fixed is the money in the bank. As you can see, all of us who are medical, we know it's almost in asystole, it's dead. Variable looks like a heart attack, God forbid that one. And then this index is like a staircase going to financial freedom. We need to understand all of this. And the person that invited you here will explain more to you how you can understand this and make it work for you. We also need to understand the types of life insurance, because the one most of us know is the first two. The group life, our job gives it to us. And then when we leave the job, we lose it. The term life, they make it look like it's cheap, but it's the most expensive. It's $9.99 on TV. It's the most expensive. We need to learn about whole life and then universal life. Again, the person that invited you will explain more, but we need to educate ourselves. Because when we do, we realize that life insurance is not just for humans. Hello, I didn't know this until I got into this business. Why do banks need life insurance in the billions? Look at 19 billion, 17 billion. When are they going to die? They're not humans. There must be a good reason. We want to know that reason. And businesses, just like my dear nurse practitioners that have their own business, my dear doctors that have their own business, my dear physical therapists that have their own business, look at businesses having life insurance. There must be a good reason. Even everyone has a life insurance. When they have that life insurance, they use this type of products, executive bonus. Please, my people, give yourself bonuses. The person that invites you will tell you more. Give your key employee, get them a policy, and then get yourself a policy to protect you. We also want to talk about generational wealth and legacy. This is not new. This is not new. In biblical times, God, whose name is Jehovah, knew the importance of leaving wealth and legacy to families. The Israelites, he divided them into 12 and gave them their own portions of the land, of the promised land he promised them. So this thing has been there for a long time. And then culturally, from where we come from before we crossed the river to come to this country, our parents, what they knew is they have lands, they have a house, and then when they die, they divide it. But we didn't know how to manage it. So eventually, even if they left us money, the money will eventually go. Or if it's a prodigal son, they left the house, they will go sell the house. They don't know what to do with it. So let's learn. Now we're in Rome, let's do like the Romans. Let's look at the Vanderbilts. What did they do with their inheritance? They didn't know what to do with it either. They lost it all. It's all gone. But what did the Rockefellers do? They knew how to manage their money better. In fact, till tomorrow, their money is still alive. One of the things the Rockefellers did when they developed this trust for their families and their generation, one of the things in that trust is what we call today $1 million baby. I wish I knew this when I had my children. I had both of my children in this country, but I missed it because I didn't have this knowledge. It's not taught in schools. The Rockefellers knew it, and they transfer it from family to family, and they're doing well. They're playing golf, and their money is making money for them, while me and you is doing 12-hour shifts. You see Dr. Benny, she's at work, trying to feed her family. So please ask the person that invited you, what is that thing she's talking about, $1 million baby? Please get it for your family. And through that, you can leave generational wealth for your children for generations to come. Here in this country, when we buy homes, it belongs to the bank. So there's no home to leave to no children. In fact, if you're not careful, if you leave the home to that children, the child is going to be tied up with paying taxes on that house. It's more of a problem for our children than giving them wealth. But you start with this $1 million baby, you could never go wrong. Ask the person that invited you. So when it comes to actual healthcare, providing care for our patients, what is our responsibilities as providers? My colleagues have talked a lot about this. Number one is that the kind of care we give, preventive care, can save lives. For example, somebody who is going to do life insurance, they may do blood work and they may find out, oh, this person has a PSA level. They didn't know they have a PSA, but I'm sorry, PSA for those of us who are not medical is the blood work they do to check for prostate cancer. So some people don't even know they have it. We have examples of people like that who they only found out because they're trying to apply for insurance policies. So this is a good thing when it comes to that. Now they know they have this, they go take care of themselves. However, as a provider, when we have inaccurate diagnosis in our patient's charts, when the billing and coding is not correct, it affects our patient's ability to be insured. It affects our patient's ability to have the kind of premium they can afford. It may increase their premium. It could delay, if we delay to provide their medical records to the insurance company, that patient might not be insured. Please, healthcare providers who prescribe, please don't prescribe medications for someone else under somebody else's name, thinking we are helping our families back home. Because I know how it goes when you are a doctor, you're a nurse, your husband is a pharmacy. They think it's like Nigeria where you can just go to the pharmacist and get medicine. No. So when you are trying not to explain, trying to say, okay, let me just do it, so they go. And you prescribe that medication, it's in your record, in your name. When you're trying to apply for insurance, they come back and say, oh, what were you using that medication for? Now you're stuck, you can't explain yourself, because then you get into trouble with your medical professionals. But then you can't get insurance because they think you're sick when you're not sick. When I say, please, accurate diagnosis is important. This affected me. It took me 6 months to get my policy. 6 whole months. And the only reason it took only 6 months is because I am a medical provider. Dr. Ruth went to town and fought on my behalf. Somebody else's diagnosis was put in my medical records that I didn't even know. If not that I am applying for insurance, it will be there till I die and I won't know. So when it was brought to my insurance attention, you're denied insurance, I'm like, what? I don't have that diagnosis. As a medical professional, it took me 6 months to be able to resolve this. And the only thing that saved me is because that thing they included in my diagnosis was a congenital abnormality. So I was able to plead my case like, how could a congenital abnormality just show up a few years ago? It should be something that has been in my record all this time. If you go back and look, it's never been in my record. I don't have this disease. Please check my blood again. And again, when I say please don't delay to send that medical record that the insurance is asking for from your office, I know some of us don't even know it's asked because if you work in a big hospital, they just ask somebody else. But because I'm a medical provider, I was able to plead for myself. I had to go into my medical record and copy all of my own records from my patient portal. Dr. Ruth's email was full of medical records. Please send it to them. And I gave her the permission. Please, I tell them I gave you the permission. Send it to them. This is me. This is my whole history. I don't have this diagnosis. So please, it's important It's important. So when praying for that job, in this case, a medical job, and now a licensed financial professional, pray for a work environment that won't lead to depression, burnout, and regret. Healthcare is very stressful. They don't pay us enough. But when you cross over to wealth care, they pay you more than enough, and it's less stressful. The things that causes stress is when we're fighting for our clients. That's a good fight. That's a fight I would take up any day. Okay? So we're at this junction now. Some of us start late, like me. We can't go back, but I can start from where I am now, and I can change my ending. I can change the ending of my generation. I can change the ending of my family, of my community. Because when we know better, we do better. Okay, so what are you waiting for? Those of us who are here now who are not yet licensed, ask yourself, am I financially literate? Start thinking how to shift from wealth care to healthcare. If you say you are protected, what kind of protection do you have? Is it term? Term is good if that's what you want, but if you want something else, look and say, are you adequately protected? Do you have the estate planning in place? Like I said, if we leave homes for our children, we're going to leave them in debt. Let's put it in a trust. Let's protect our children. As I put in red, join us today because tomorrow it could be late. By the way, during those 6 months, while I was fighting to get a policy, I also had surgery on my knees. So of course, that escalated my premium by 1.5 points. Please learn from me. Tomorrow could be late. The mentoring you get here, remember, they don't teach you this in school, but you're going to get mentored here, cutting edge, 5-year training. You're going to make it. Because there's no team like Royal Star Team. We are royalty here. Thank you so much for listening to me. Thank you for this opportunity, Dr. Ruth, to present to my colleagues and to the community. I'll yield back to you.
Wow. Wow, Dr. Ola. Thank you so much. Guys, these people are taking their Saturday to educate you. These are providers. These are people who have seen it all. They have done it all. They have finished all the academics. And we're coming back to the drawing board to learn. Dr. Ola, thank you so much for sharing your knowledge. Okay? I'm going to end it with this. Sometimes some people hear something and it's like theory. So today I put some of those in the chat so you can see. If you're a guest in this chat, can you put 1? If somebody invited you, this is your first time hearing that the providers play a bigger role. Can you put 1 in the chat? If you're not a guest, can you put 2 in the chat? Maybe what you heard today, you have never heard it in this perspective. Now they are talking about decline. The healthcare providers plays a bigger role. Dr. Linda said it, Dr. Benny said it, and Dr. Ola said it. You are the center of protection portfolio in United States. Okay? And look at this right here. There are 2 financial environments in America. It's investment and protection. The investment can be given by anybody, your social media, your CP, accountant, financial advisor, business analyst. If you look at what Dr. Ola said, what we are talking about is not taught in the classroom. Now that all of us are too educated, we are caught up with analysis paralysis. We're trying to identify your risk and manage it. Each time we come to you, you're telling us, I can put this money in investment. So my brothers and sisters, I want to let you know, providers, as you're talking to your patients, let them know that protection has no business with investment. You need both. You need investment and you need protection. Let them know that the law of United States and Canada allows them to put in up to 20% of their annual income in protection. It is not investment. Please do not compare. What if I take this 2,000 and put it in my investment? What if I take this 3,000 and put it in my investment? It is not investment. It's protection. It manages your risk. Your investment is there for accumulation. That is what it's meant for. And unfortunately, most of us have what we call CPAs, accountants, financial advisors, bankers, business analysts, social media, pastors, environment, imams, and all that. Let me tell you, these are wonderful people. But for you to engage in protection, you must be licensed. So don't leave here and say, let me go ask my CPA, because that is why physicians, nurse practitioners, doctors, teachers, PhDs, they don't have policies. Because when they hear protection, they're thinking about investment. When they hear protection, they say, let me go ask my CPA. If your CPA do not have your accountant, your financial advisor, your business analyst, if they do not have life insurance license in America or Canada, they have no legal right to advise you on protection portfolio. If they do, one, they are violating the law. Two, they're going to give you know what Dr. Linda said, they become a quack doctor. They are quack financial doctors, because they are trying to advise you on what they do not have the legal right. So don't leave here and say, let me go ask my CPA. If there's any question you need to ask your CPA, the only question I will ask you to ask them, sir, I know you've been my CPA for 30 years. You have done so well. Do you have a life insurance license? That's all you ask. Don't even take it, somebody in my office, no. Ask, do you have a life insurance license? If they say no, they have no legal right to talk to you, a provider, or for you to take information you get from them to go tell your client. So you need your protection and your investment. It's not either or. It's your protection and investment. But your protection comes first, because that is where your health matters. Your income matters. Your age matters. Your driving record matters. Your criminal record matters. Anybody can wake up 100 years to do investment. I hope somebody is getting this. Now, let me tell you, these are people that did policies. Okay? So, look at this. That was 2024. Thank you for me submitting the application. Unfortunately, we cannot issue you a policy due to her height. Dr. Linda talked about BMI, weight, diabetes, pre-diabetes, and referral for assessment of sleep apnea and thrombocytopenia. As a provider, if you order medication or any therapy for your client, make sure you discuss with them. Unfortunately, most of you document when your client has gone. And while you're documenting, you remember that, oh, this person needed a referral for foot leg, for heart rate, for this and that. And you put it in your note. And you forget to go back. And your assistant will see the note. And they will make an appointment for that patient. But they never told the patient there's an appointment. And now the patient is walking around, not knowing that that's the decision you made after they have gone. You go to the emergency room. This is now for consumers, and providers, you're also consumers. You go to emergency room, they say, hey, a mental health breakdown. Follow up with your physician. You go home, you didn't follow up. Guess what? There's no discharge in the chart. That will count against you. It's going to impact you financially, which will turn around and increase your stress level. And when your stress level is up, your cortisol continue to fire. Guess what? You get worse than what you think it will be. Look, this is what? This is 0302 here. Okay, let's look at this one. The pathology on the prostate cancer could not be considered until maximum of 5 years after completed treatment. Case also will be declined for PSA. I think I put that in the wrong way. Now, this one here, decline lab result, CEA 6, urine proteinuria 264, creatinine, urinary retention. This one don't even know they have a problem. It was the lab insurance that brought out that one. 2025, decline due to A1C, triglyceride, cholesterol, serum albumin. Look at this. So you as a provider, if you have a life insurance license, And know that once a child is born in your hospital, or they brought that child for awareness, the first thing you should be asking as part of your checklist is, have you already gotten a protection for this child? The right one, not just GABA. If the GABA you want to do it, but make sure you have the knowledge. Let's see. Decline due to height and weight. Height and weight. Height and weight. Look at this one. Decline due to medication or diagnosis information from automated database queries. CAD, coronary artery disease, ADHD. Now, what is happening? The country is at war. You know, when the country is at war, sometimes they want to enlist the armies. And there are certain diagnoses that is in the chart you will not enlist. And there are a group of people who are sitting down to advocate for parents to take their children to go to the doctor so they will put them diagnoses in the chart. There's no problem. That's what you want to do. But please, before you put that diagnosis, make sure you have protected your child with life insurance. The right type of life insurance. I don't care which one. The person that invited you here will tell you the types. You don't have to believe it. That's the truth. Don't worry about too many social media who tells you that life insurance is a scam. Don't worry. When you fall sick or when these things happen, the social media will not be there for you. Look, ADHD. Look at them. Medication. All the psych medications in America count against your child. Can you protect them? It counts against you. And let me say something else. If they give you medication, do not stop it on your own. If you feel you're good, you can't take it again. Guess what? Please, go back to that doctor and say, I'm not taking this medication again. Can you discharge me and discharge this medication? Let's see. Decision based on confirmed Milliman. This is where your medical records are. If you don't know, write it down. Milliman report. The same way you have criminal record in America and Canada is the same way you have medical records that goes to one place called this Milliman. Whether they are human being or not, only God knows. But Mr. Milliman, that is what Dr. Ola told you she fought. She have to fight Mr. Milliman. But unfortunately, Mr. Milliman do not have control of what is in your report. It's from your provider. And the provider sometimes they just do the diagnosis. But the biller who have MBA, that is not a provider, will not put the diagnosis that will give them the nice paycheck back. And whatever the biller puts in is what goes to Milliman. And that is where insurance companies go. MIB, Dr. Lina said it. Okay? Client can contact. You have the right to contact Milliman to check what is in your record. You have the right. Okay? You can contact them and check their record. This is their email. Think you can email them or whatever. So copy this if you care to know more. If you want to walk into that Milliman office, it's up to you. But all of us in America and Canada, especially America, our life depends on Milliman report. If you want to achieve financial freedom, Milliman report is your friend. And who generated the report in Milliman is your provider. That is why we're going to do this every single month. If you like to make a change, invite providers. All right? Look at the decline due to lab result regarding elevated PSA 5.84 with free PSA of 16%. This one, the even managed, they say can consider once this has been evaluated at client own risk and expense, no guarantee of future offer. Okay? Look at this one, decline. Diagnosis database from who? Mr. Milliman. You can use this and ask your doctor, Dr. John, do you know about Mr. Milliman? What is that? Okay, let me show you. Mr. Milliman. Criminal record you find somewhere else. Driving record you find somewhere, but Mr. Milliman is hovering over all of us from A to Z, both rich and poor and anything. Look at CHF. By the way, this person that this policy was cancelled, let me tell you why. Let me tell you one thing. They had a policy 3 years ago before this time, and they cancelled that policy because they watched too many social media. because their friends say is a scam. Their pastor says evil spirit. They cancel that policy. Now they are educated. Remember, Dr. Ola said, we identify, we educate, we protect and empower. She was lucky to be identified again, to be educated. Now she decided to make decision. Guess what? Now she's about to make decision. What's in the record? Diabetes, hypertension, CHF, and look at that, declined. And this is a single mother. Now you know the complication that will come with these things. As she advances in age, this condition will get worse and it's going to impact her finance. Guys, do not cancel your policy. Your protection comes first. Do not cancel your policy. Some people say, I cancel my policy to take care of family needs. No, that is because of that family needs, you need to keep your policy. Because the reason you're making money now, because your heart, you're in good shape. No diagnosis in your chart yet. Guess what? This is a complete victim of canceling policy due to ignorance. And now when they are able to do it, they have the money, they cannot. So you can wake up to do investment, you cannot wake up to get your protection. Dr. Ola says, start today. Go to the person that invited you to tell them to write you a policy. It has nothing to do with investment. You can still do your policy and do your investment. Look at that. Decline due to what? Chronic kidney disease. So you don't think we're just making our stuff. That was the one we read before. Okay? This person was just diagnosed with, he was diagnosed with what? Prostate cancer. They will not consider them till after 5 years. Hopefully nothing else happens. Anything can change your life. Now, let's look at this one. This was not decline. They have agreed, which was my biggest surprise in my lifetime. They have agreed to do what? To offer this one policy. But look at what they say. File looks table E. Table E. And riders are denied due to diabetes and A1C of 9.3. I was the shockest of my life that they even managed to agree at A1C of 9.3. What do you think is happening to this one? This person can wake up and collapse and die. You say their neighbor, their father have killed them. Their grandfather has killed them. Your grandfathers and your neighbors don't kill nobody. What kills us is our brain. They say your fathers are ancestors, they are bad. The day you die, you become ancestor. Are you a bad person? If you're not a bad person, never you open your mouth and say your forefathers are bad people. They are not. Now, do you know what this means? They say, please advise if primary insured wants to be proceed. You know what it means? This means that their cost of insurance will increase by 225%. They have agreed, which for me, I'm looking for approval. And I don't care about anything. I'm looking for that word approval. So this person is lucky. He will get the word approval if he agreed to go with this. But because he came late, but they're still trying to give him a little bit of opportunity. His cost of insurance will not be as those who are normal. His cost of insurance will increase by 225% as he advances in age. Guys, this is the danger. This is why healthcare providers, you must get a license and become part of this crusade. Even if you don't help anybody, you get a license, you understand the laws, and you refer them to those who are willing to help. We cannot continue to live in this kind of environment anymore because the cause of this is financial ignorance. And Dr. Ola have the diagnosis done. You can tell your client, diagnosis of today, financial ignorance. Send them to where they need to go. Unfortunately, it's not in the clearance house. Unfortunately, clearance house has not approved that. So who's going to support us to go to the clearance house and ask for addition in the ICD-10 code or ICD-11 code? Financial diagnosis. Because if they're going to put terrorists as a medical diagnosis, they should as well put in what? Financial diagnosis in the clearance house. So think about this. If you don't have policy, you're hearing us, go to the person who invited you to write your policy today. Your protection has no business with investment. You need your protection first. You need your income replacement so that in case you fall sick, do you know if you fall sick, your job will let you go? That source of income is no more there. Your health insurance will take care of your medical bills. Even if you have Medicaid, take care of your medical bills. What takes care of your lifestyle is your life insurance. So don't be deceived anymore. People decline insurance because they are healthy and young. Insurance declines people because they are sick and old. Providers, let's get the people when they are young. When it comes for those checkup Dr. Linda mentioned about annual check, annual awareness, let's protection portfolio become part of your discussion. But before it becomes, you need to get a life insurance license. So that if anybody they challenge you, say, no, I'm saying this because what? I am legal. I have the legal capacity to say that. Some people say it's conflict. There's no such thing as conflict. It's part of the protection. You are licensed. Your job want to let you go, let them let you go. Tell them you cannot let me go because I'm helping you to keep your client. Because if these people lose their job, they cannot come to patronize us as patients. But if they have a policy where they can pay their premium, guess what? And they will take care of their lifestyle, they will continue to be a patient for us. Let them, you're helping them. They're not helping you. And these are some of the task codes. For those of you that are addicted to people that are telling you it's a scam, go and read IRS code. The same IRS they gave you 401k, 403, TSP, for 529. Name them, they are the same IRS they gave you all this. Go read it for yourself. If you have questions, please call us. I want to thank each and every one of you for joining us here. If you're a guest, you're here. I hope we brought value to you. Go back to the person that invited you. Please fill out our survey. Please, I beg you, fill out our survey because this is a community service. We are spending our time to educate you, to bring you, but help us to help the next person beside you. I may not know your people. I may not know your primary provider. We're going to do this again once every month, next month. Make sure you do what? You refer your primary provider here. Your cardiologist, your brain surgeon. They are the one that actually need brain surgery, not the patient they are taking care of. The dentist, the gynecologist, the nurse practitioner, all of us have a role to play. We are in the center of protection portfolio. Charity begins at home. You start from yourself, okay, and you go to others. What we shared today, I recorded it on YouTube. It's not public, it's unlisted. If you fill out this survey, you're a guest. Your email will be there. I will send the record to you. Otherwise, thank you, Dr. Ola. Thank you, Dr. Benny. Even while you're at work, you have the interest of your people at heart. And of course, thank you, Dr. Linda, for hosting it. Dr. Linda, just to let you know the credibility and the credential of all our speakers today. Dr. Linda is a primary physician that owns her own practice. She's a mother, she's a wife, she's also a licensed financial professional. Her office is in Frisco, Texas. If you have a family member who lives in Frisco, Texas, in Dallas, they are looking for a competent physician to be their primary doctor. She's available. She also does telemedicine. Dr. Benny, yes, he's an employee, but guess what? Her mindset have changed. You can go to her clinic just because of her. Go to that clinic and tell them, I want to only be seen by Dr. Benny. And tell Dr. Benny or Dr. Linda, I want holistic approach of my life. Don't just give me medicine, give me everything that I need. And of course, Dr. Ola is a nurse practitioner, also a professor, a researcher, a scientist, and now a licensed financial professional. So this, what we are trying to build, we are trying to build all-rounder human being, service people that provide service in everything. So if you reach out to any of these three people or whoever they invited you here, if you fill out our survey, we'll get to you. We promise, have an open mind. Don't be naive and say, they are trying to sell me something. No, they are trying to help you. You remember. Thank you so much. Enjoy the rest of your day. Go to the person that invited you. Ask them to write your policy. And ask them, how can I become a legal person doing this? Because if you don't have license, you don't have no right to talk about protection portfolio. It's illegal. And walk away from 2 minutes video to make decision out of 2 minutes video, or due to pressures of life. If you cannot pay your house rent right now, you're working. You cannot take care of your people, you're working. Imagine when you fall sick or something happens, you can't go to work, and there's no income coming in and protection you don't have. Then you know that you're going to have a miserable life, not a dreams. Let's keep your dreams alive. Thank you so much and enjoy the rest of your day.
Thank you, Dr. Ruth. Thank you, Dr.